Hi, so I'm going to talk about our 13-year-old and her mom coming into the office inquiring about the HPV vaccine. So, if this otherwise healthy 13-year-old girl and her mom came in and they were interested about the HPV vaccine, these are some things that I would tell them. As we know, she has no allergies and she denies sexual activity, but that's almost one of the best reasons to get the HPV vaccine is to get it early before she actually becomes sexually active. So, HPV is so common that almost every person who is sexually active will get HPV at some time in their life if they do not get the Gardasil vaccine. And as we know, two of the biggest complications from getting HPV are genital warts and cervical cancer. I would tell the mom, prevention against cervical cancer alone is a great reason to be interested in getting the HPV vaccine for your daughter. Before HPV vaccines were introduced, roughly 340 to 360,000 men and women were affected by genital warts every year. So that's like about 1 in 100 sexually active people had genital warts at any given time. Again, 100% preventable if we can give the HPV vaccine. Cervical cancer. Every year, 12,000 women in the United States are diagnosed with cervical cancer, and 4,000 women die from cervical cancer, even with screening and treatment of cervical cancer. So again, HPV vaccine significantly reduces your risk of getting cervical cancer if you get it in the appropriate time frame and age window. There are 3 types of HPV vaccines. The main 2 are the quadrivalent HPV vaccine and the 9-valent HPV vaccine, both of which protect against the 2 types of HPV viruses that are most common, which are type 16 and 18. So the quadrivalent vaccine covers 4 types of the virus and the 9-valent covers 9 types. However, the 2 main types that we know about that cause cervical cancer and genital warts and HPV are covered in both vaccines. It's recommended for preteen girls and boys starting around age 11 and 12, and all preteens are recommended to get vaccinated to protect against HPV infections and the cancer that they cause. Who is qualified to get the HPV vaccine? Teens and adults who didn't start or finish the HPV vaccine series need it. Teens and young women can get it until they're 27 years old, but men can get it until they're 22 years old. Teens and young men who have sex with other men or who have weakened immune systems should get it, and transgender individuals should get it both before they're 27. So her daughter, being 13, qualifies very much so to start the series at this age. The CDC recommends that 11 to 12-year-olds receive 2 doses of the vaccine at least 6 months apart to protect them against cancers caused by the HPV virus. So since her daughter is 13, it is still recommended that she gets 2 doses versus the 3 doses of the HPV vaccine, but we need to make sure that they're 6 months apart. The first dose is typically recommended around 11 or 12 years old. Although her daughter is 13, it is still a great time to get the vaccine, given that she's still in her very young teen years. The second dose, like I said, should be given at least 6 months after the first dose, but within 6 to 12 months is the ideal range, but it does need to wait at least 6 months after the first dose. And the 2-dose series, like I had mentioned, is okay for ages 9 to 14, but once her daughter would turn 15, she would need 3 shots to become fully vaccinated. Why you should get it? About 79 million Americans are currently infected with HPV. 14 million people become newly infected every year. It's so common that almost every sexually active person will get HPV at some time in their life if they don't get the vaccine, like I had said before. Since the vaccine was introduced in 2006, there's a significant reduction in HPV infections, and research shows that fewer teens and young adults are actually getting genital warts, which is something that's really great considering the HPV vaccine can almost fully prevent it. As we know, vaccines aren't 100% effective, but it significantly reduces the risk of getting the virus. Genital warts has decreased dramatically in young adults in Australia since the HPV vaccine was introduced, as well as the number of cases of precancers of the cervix in young women in that country as well. And yes, I know we live in America, but the CDC compares a lot of our infection rates to Australia, and so that's what they recommend as well. I know vaccines can be a little scary, and so it's really important to just go over the side effects. Sometimes when you get a vaccine, you can have some pain, redness, or swelling at the site of injection. You can get a mild fever, and that's okay. It's not that you're sick. It's just sometimes when you inject a virus into you, it can give you a little bit of a mild fever. A headache or some fatigue or feeling really tired after you get the vaccine. Maybe some nausea and maybe some muscle pain at the site of the shot. So it's those are some things that I would tell her mother about it, and I would also want to talk to her. Sometimes it can be a little bit intimidating knowing that, you know, my 13-year-old daughter, thinking about her becoming sexually active, and just reminding the mom and the daughter that while you may not be sexually active right now, this will protect you from getting the HPV virus later in life by getting this vaccine. So, or not necessarily fully protect, but significantly reduce your chances of getting the HPV virus and in turn cervical cancer or genital warts. Because at one point in your life, you most likely will be sexually active, so why not get the vaccine now when you're at the perfect age to start the vaccine for it to be most effective and have the highest rate of success in you now. So let's just, you know, answer their questions. We'll talk to them a little bit more about it, see what other questions they have, but those are a lot of the points that I would talk to them about. And I would also just want to talk to the 13-year-old to just kind of get a sense of her feelings and her understanding. 13 is a very vulnerable age, and you know, she's just kind of learning more about her body, and she may be getting her period, and so she's probably just overwhelmed with all these things we're saying to her. So I would just want to make sure that she fully understands why we're doing this now. Because she's 13, you know, she can make decisions. I'm not saying that she can fully make lots of really big decisions, but she has a good understanding about things that we're talking about, and she's probably starting to develop her own sexuality and becoming more curious. And so it's important that you educate her about the importance of this for later down the line in the world of her own sexuality and sexual activity. Yeah, so that's it.